So this patient is probably towards the tail end of the second phase of rehab, which would be the proliferative phase, or at the start of the maturation phase after 6 weeks. Some contraindications for the use of cryotherapy would be if there's any vascular compromise or vascular disease, if they're intolerant to cold therapy, also if they have other diseases such as like Raynaud's disease or cryoglobulinemia. Some indications for the use of cryotherapy with this patient would be to reduce swelling, to reduce pain, and yeah, those are probably the two biggest things with this patient. So let's do it. So hi Brad, my name is Joseph. I'm your student therapist today, working under Dr. Clausen. How are you?
I'm doing good, thank you. How are you?
Knee, I'm sure you're ready to get that thing moving.
Yeah, very much so.
So I see that you've got some swelling. Do you have any pain after this first session?
It's a little achy,
Okay.
yeah.
Okay. So we'll probably use some cold therapy to help both with your swelling and your pain that you're feeling right now.
Okay.
Have you used cold therapy before?
Like ice, like an ice pack? Yeah.
Pretty much.
Yeah,
Yep.
all the time.
Okay, sweet. Well, like I said, one of the reasons we're using it is to help reduce that inflammation and pain, so you'll feel better at your next therapy session.
Okay.
So we'll go ahead and we'll get that started.
Okay.
I'm gonna have to kind of check out the area, make sure the skin is okay. Is that okay if I kind of feel around your knee and stuff? Okay. It looks good to me. Are we kind of feeling everywhere I'm touching?
Yeah.
Okay. Okay, sweet. So we'll get started. I'll put a couple layers down to protect you from like direct exposure to the cold. I'll pull this short leg up a little bit. Okay. I'll put a second layer down. If you can't really feel the cold too much, just let me know and I can remove one of these layers of towels.
Okay.
All right. I'll put this on. And I am going to kind of strap it down. Can you bend that knee slightly? See? Okay, that should be good there. Is this too tight on your knee or anything? Or does
No,
it feel okay?
no, that feels good.
Okay. Avoiding that patella. So.
It feels good.
Sweet. Okay. All right, Brad, so I'm going to give you this bell, okay? I want you to ring it if anything starts to feel weird or you maybe feel like it's kind of starting to hurt or burn or anything.
Okay.
We'll do this for about 10 minutes, and then we'll send you off home for the day and see you for your next session, okay? So you should, just kind of a heads up before I leave, I'll set a timer, make sure we're not going over those 10 minutes. Like I said, it should not burn. If you start to get a little concerned about how things are feeling, ring that bell. I'll be in here as soon as possible. Also, feel free to just kind of rip this pack off and throw it on the ground if you need to.
Okay.
Okay. All right, so 10 minutes is up. I'll come in and remove this. How's that knee feeling now?
That feels good, nice
Yeah.
and cold.
Probably can't feel it as much. Huh?
It's probably a good thing right now.
Yeah, it probably is. Okay. So I'll take this off, make sure we didn't burn or anything like that. And yeah, that looks good to me. Feel good to you?
Yeah, it feels great. Thank
Sweet.
you.
Yes, sir. You're welcome. See you next time.